Welcome to the Medical Trauma Support Podcast, the show where we shine a light on the hidden impacts of medical trauma, explore tools for healing, and empower you to take control of your health journey. I'm Sarah, your host, a passionate advocate for trauma-informed care, somatic healing, and compassionate conversations. I'll bring you expert insights, healing strategies, and personal stories of resilience to help you feel seen, heard, and supported on your path to recovery. Welcome, everyone, to the Medical Trauma Support Podcast. And today I have Whitney Casal and Lauren Isbell from the Nevis Outreach organization. Thank you for being here, y'all.
Thank you for having us.
Thank you.
So I'll share with the listeners that if they have been listening to the podcast, Kelsey Wesley was on the podcast not a full year ago, I guess probably about half a year ago. And she is really engaged with y'all at the Nevis Outreach organization and suggested that I talk to you because y'all are supporting families every day as they're making decisions about whether or not to go have medical procedures essentially for their kids. But I would love for y'all to introduce yourselves a little bit more deeply than I did and share a little bit about your work and the work that the Nevis Outreach organization is doing.
Lauren, why don't you go first?
Okay. My name is Lauren Isbell, and I have the pleasure of leading Nevis Outreach day to day. I'm their executive director and really trying to set some strategic vision for the organization and speak into some leadership. And I'm really excited about the opportunity here to think about how we can support families at every stage of their journey. And I feel like that's so important. So we're a rare disease patient advocacy organization affiliated with Congenital Melanocytic Nevi. I always say it's okay if you've never heard of it. That's our job to tell people about it. So it's a rare skin condition that affects, generally speaking, 1 in 20,000, and some of our more severe cases, upwards of 1 in 500,000 people. So it's a pretty rare condition. And my personal connection is that my daughter was born with a facial CMN in 2017. So that catapulted me from working in the adjacent nonprofit space to leading this organization. Whitney?
My name is Whitney Casal. I'm the Director of Membership at Nevis Outreach, and I have the pleasure of working with Lauren every day, although remotely. I was also born with giant CMN, so that's my initial connection to the organization. My parents found Nevis Outreach when I was really young, when the internet was just starting up, and we've been connected ever since. So it's really a very full circle moment to be on staff with them and be able to work and contribute to our efforts every day.
Yeah, that's really beautiful. And I think both of y'all having lived experience, whether for yourself or your children, and being drawn to this work must be like especially meaningful to the people that you're supporting that are reaching out to y'all to get support. So, one of the things that I've talked about with you is that there are oftentimes decisions that parents or choices that are kind of given to parents about how to support their children when they've had this diagnosis. And I believe, Whitney, when we first spoke, you said it's you would know once your child is born. Is that typically how it looks?
Right. So oftentimes, and Lauren, I'll let you speak to this more, but my understanding is that there's no way of seeing the CMN before birth. And so it's oftentimes a shock in the delivery room once the baby arrives. People are seeing something that they're not familiar with and they don't know what it is. And that's often times also like a very urgent moment for the family.
Yeah, we kind of call it that lightning strike in the delivery room because that's about your same. It feels like that's the same odds as being born with CMN. So that, kind of initial shock. And then a lot of times there isn't clear understanding, obviously we're working to raise awareness with medical providers, but at the same time, we do have pockets of places where a child is born with CMN and someone doesn't know what it is, and it takes a little bit to get diagnosis, but usually fairly right after birth you have a diagnosis, and connecting with a pediatric dermatologist is often the next step, and then at some point down the line you're sitting in rooms talking about how can we treat this? What are our treatment options? And as of right now, the majority of those treatment options are centered in surgical intervention.
Mm-hmm. And for the people that are listening that are kind of unaware of what this is, can you describe how and what might they see to know that this baby has CMN?
Yeah. So CMN is pigmentation where there should not be pigmentation. I always kind of describe it as um, it's very large birthmarks most of the time. Like that's kind of what it appears as a birthmark. It's uh, deposits of melanin on the skin where you wouldn't expect that to be. It's a mosaic mutation. It happens. Basically, that means it happens randomly. There's at some point during embryonic development, and how early it happens kind of indicates how extensive the CMN will be on the body. So my daughter's is about the size of her fist underneath her eye here. So we imagine that hers happened later in embryonic development than say Whitney's, who covers a much larger portion of her body.
Right. I have what would be classified as a bathing trunk nevus, so it covers approximately 50% of my body, like kind of in the middle portion. The coverage can just range extensively. The color and texture of CMN can range from person to person, the thickness, the hairiness, the coloration, all of that kind of stuff, and even like additional nodules, bumps, lumps, all kind of different ways that it presents.
And is there a health risk with CMN?
Yes. So the exact numbers on this increased medical risk because we're a rare disease and honestly have limited research, but it's believed to increase the likelihood of melanoma over the course of one's lifetime. I would say probably 20 years ago, we thought that increased chance was a lot higher than we anticipate it to be today. I feel like that's a fair assessment. With all the numbers kind of fuzzy just because of lack of medical research, but then and lack of longitudinal studies. And then there's also an increased risk of the same melanin deposits that are present on the skin can also be present on the brain and spinal cord, because the skin, the brain, and the spine develop at the same time in embryonic development. So since 2018, we've had recommendations of imaging of the brain and spine early, ideally within the first year of life. Those recommendations did not come out until 2018. So there's a large portion of our population that have never had imaging. So we're not sure what their baseline MRIs would look like because it would be impossible to get them now. But my daughter, I would say she's 8 now, and probably one of the first, among some of the first, to have that recommendation before 1 year of age and have an MRI. Now it's not uncommon for me to hear of families that are having those MRIs conducted very, very early. I mean, as early as less than a week old, and they're already like going for an MRI. So that can be challenging for families to like not know about this diagnosis and then get this diagnosis in the living room and then immediately be like, oh my gosh, do I put my kid under anesthesia? Do I not? Like those kinds of immediate decisions just for baseline imaging. And then as you think further down the line about treatment options or removal, then, how do we make those decisions? What are our options? What are our choices? And all the things that come with that. And it's just a lot. It's very heavy.
Yeah, that's what I was thinking as you were talking about this, and like what the experience is for new parents. So you have a new baby and all of a sudden you're being told, okay, well now you're going to need to have an MRI because this could also be on their brain and spine. That's really scary for a new parent to be told that, right? You go and you meet with a pediatric dermatologist. There's just all of these unexpected medical experiences, and that can be really hard. And I'm curious, I know that a big part of your work from talking to you is that you offer support to parents who are in this place. And I'm curious a little bit about what that looks like and how they reach out to you and what the community looks like.
I think that the main support that we offer families is connection in a community of people who get it, who understand, who have walked similar roads and can kind of lean on each other and create a network of people who understand. I feel like our aspirations are huge as far as what we want that support to look like on down the line, but what we offer today is really just that connection with each other through an online private group, and then also like we have a patient conference where we bring families together every 2 years. We've been doing that conference since 1998. So Kelsey, who you mentioned earlier, and Whitney grew up as little kids coming to those conferences together. So I think, I mean, that our being here today, like, kind of speaks to the testimony of those connections. And once Kelsey had a chance to talk with you, she was like, oh, you guys need to connect with her. So, and so I think that kind of just drives home like how important those in-person events are. And then aspirationally, we have ideas for lots of different support mechanisms that we hope will come at least eventually as we have time and resources to build them out. I don't know, Whitney, anything you would add there as someone who's kind of leading the charge on those support initiatives?
Yeah, I guess it's just been really incredible to watch sort of the growth and iterations, having attended those initial conferences when I was very young and growing up with Nevis Outreach is a very central part of my life. I agree that family connection has been such a central part of, I think, what the organization does and does really well. And, as we've seen technology advance, as we've seen social media explode, and all of these things develop that didn't used to exist, it's amazing to watch the community grow and watch those different forms of connection become available. So, I was born in 1992 in Spain. My parents were told lots of very inaccurate information about my CMN in my first couple of years of life. I didn't have any imaging done because that wasn't recommended at the time. And so, they really had to seek out specialists, travel to different places, talk to different people. And only until we didn't meet anyone else with CMN until I was 6 years old. And so just imagining the evolution to now where, we get new members who have 2-month-old babies who have already connected with other CMN families and maybe have had imaging done, or, even just being able to come to our website and find all of those resources. What is this? What are my next steps? Having some of that information directly from a patient organization, I think, is really impactful, or at least that's the hope.
Yeah, I mean, I think it is, because when you talked about connection with people who get it, like, that's one of the things that I talk about with medical trauma support and why I created the community that I did, because it can feel so lonely and you can feel so isolated when people in your immediate community haven't experienced what you've experienced. And it can feel like there's something wrong with me then. But it's like when you then find the other people who feel the way you feel or who have experienced the things you've experienced, it's so, I don't know, soothing after kind of the first initial like big emotions that can come up of like, oh my gosh, there's other people. I'm not alone in this. There's just this like there's nothing wrong with me, right? Like, like wrong with me, I'm not the only one who's feeling this way. I'm not the only one who's gone through this. And I just think that's so beautiful that y'all do that. I think, like, obviously I think about medical trauma and these hard things often. And I think when you're a human, as we are, hard things are going to happen. They may be medical things that are challenging. They may be other things. But like, what can we do knowing that this experience of being human is going to have challenges? And to me, the number one thing is to find supportive community around it. Like, that's kind of like step one, in my opinion. And so I think the fact that y'all are doing this for families is so beautiful, because as my child doesn't have CMN, but like my first kid, so it was my first time to be a parent. We were surprised by a lot of different medical things that were happening. And when you are new to being a parent, you have this brand new little baby that you already love so much, and you're being told like, oh, they're going to need this specialist, they're going to need to do this testing, they're going to need to do this, and you're going to have to make these other decisions. It's so overwhelming in a way that I think is hard for somebody to understand that hasn't experienced it. So I think it's so beautiful that y'all are creating community for people that are going through those experiences and having to make choices. And that's Another thing that I wanted to talk about is being the parent of this little infant and being given some choices and not knowing the future, right? We don't know the future. So we have no idea what the best thing to do is. And that's really hard too. It's almost like when there is not a choice, there's a little bit of like, well, there wasn't a choice. That's what I needed to do. But when there is a choice, it can make it even harder on parents, I think, to decide, do we do this surgery? And so I was hoping y'all could talk a little bit about that from like your own experience or the experience of some of the clients that work with you.
I'll take a stab at that question. It's a little bit loaded, but I'll give it my best shot. I think about, if we wound the clock back 25 years and we said, and someone is born with CMN, and of course, some of our older population had skin grafts and different things, like very extensive. But I think that as treatment options have evolved, like it's a little bit different, but but at its core, I think there's plenty of people then and even today that don't feel like feel like surgical interventions is the only choice they have. And I think that because their doctor is like, hey, this does increase melanoma risk, this does maybe decrease melanoma risk if we take it off. And then there's the flip side of that coin. Well, if you take it off, you can't observe it. And really, for every family you meet, there's 50 different opinions on that particular instance of CMN and how you move forward with it. So that's a little bit overwhelming too, because we don't have consistent, like, this is what you do and this is your treatment plan no matter what. And there is choices and options at every step of the way. And that's challenging for us as an organization. Like, how do we support families there's families who haven't had any imaging and won't have any imaging. There's families who have a completely intact nevus, have never done any removal, haven't even had so much as a nodule removed, like, nothing, no treatment interventions at all. There's families who are very diligent with dermatological care and connecting with the specialist. And then, I talked to a young lady last week. She was in her 50s and 60s. She was like, you know what? I haven't been to a dermatologist since I was 8. Is that okay? And I was like, at the end of the day, like, it's your prerogative of how much, she's like, my PCP knows about it. And I guess if anything ever happens, I'll figure it out then. And I'm like, I mean, it's your decision. You know what I mean? It's your decision. And then I think, myself as a parent with a child with a very visible nevus, I think that plays into it too. I think there's situations where, in like Whitney's case, like her CMN is mostly covered if she had, considering if she has just normal clothes on every day. But like, Maylee can't walk through the grocery store without every single person. That's my daughter. Can't walk through the grocery store without every single person, like, kind of looking and, maybe whispering, hopefully not, but like, at least catching the attention of anyone anytime she goes. I say she gets more free stuff than anybody I've ever seen in my life. Like, people are always like, oh, have a lollipop or whatever. It's just bonkers how much people react to it and try to, like, I think they react to it and then they're like, oh, how do I make this right? And they're like, oh, here's a teddy bear. It's just wild. But just thinking about those experiences, like, very widely, and like, so therefore people's reactions to them and like how people weigh the invasiveness of our current treatment options is going to land all over the board. And if you've talked with one family with CMN, you've done just that. You've talked with one family with CMN. And we do our best to share stories across every piece of it to help families know that wherever they feel like they're landing, they're not alone, that people have landed there before, and create community around that. But I will say it is probably one of the most challenging topics of leading this organization and trying to just make sure that, I mean, of course, we want to try to advance science in a way that gives us less evasive treatment options down the road if they're to be had. Of course, we want to try to validate people who are living with a visible difference and do have to, like, walk that road every day. Of course, we want to, like, stand with families in the delivery room and in the room where they're getting their MRI and like knowing that knowing that they're going to be okay. Like, even though that they feel overwhelmed with the decisions they're having to make in the moment, like there is a path forward, and wherever you land with those choices, that you have a community here that's going to support you. And that is a really tall order.
Yes, I can imagine, because again, having a lot of choices can sometimes be harder, because you're like, what if I make this choice? What does it look like 5 years down the road? What does it look like in 1 month? What does it look like when my child's 40? And knowing that, you talked a little bit about like your daughter walking into places and people like stare at her in the grocery store, making choices about that, because when we're parents, we're not only thinking about our children's physical well-being, we're thinking about their total well-being and trying to make the best decision every day that we can. And knowing, again, we're human and we're going to make mistakes, like in every way, right? We're going to make mistakes. And so I love that y'all are supporting people in whatever way feels best to them and not dictating that this is the only way. I think that to me, that's true support. Having people come in as who they are and with the choices that they've made. And, I want to like talk a little bit more about Kelsey's experience that she shared on our podcast. And her experience was in the 90s. I feel like people have maybe gotten a little bit more kind. I don't, hopefully, about differences, because we all have differences, whether they're visible or not, but visible differences are obviously when you walk into the grocery store, they're obvious immediately. And her parents chose to have her nevus removed. It was on her face, and she has gone through a series of surgeries. And in her experience, not that this is everyone's experience, there was trauma that came along with those surgeries. And so that's what she shared on the podcast episode. I'll actually, for the people listening, I'll link to that podcast episode in the show notes so they can hear a little bit more about her story. And she's done such beautiful work in her healing journey from her medical trauma. But I just want listeners who aren't familiar with some of the ways that people may treat or remove the nevus to understand that there is like this, like you said, this very wide spectrum of choosing not to do the imaging all the way to choosing to have the nevus removed, and that it can take a series of surgeries that span many years. I believe Kelsey shared hers spanned about 13 years. Yeah, so I didn't know if you wanted to talk any more about that and what that's like for those parents that come to you that have chosen to take that route, because it is not easy as a parent to make a decision for your child to have surgery and then preparing for the surgery and the day of the surgery. And then after the surgery, as your child is healing and in pain, that's not an easy choice to make.
Not at all.
Right. I was just going to say, I'm having a lot of thoughts, like Lauren mentioned, there's so many things going on. There's a lot of decisions to be made also in a very sort of urgent manner. I think that puts a lot of pressure on parents. Obviously, I don't have that parent perspective being the person born with CMN, but I've heard my parents' story. I've heard lots of stories from other parents. Because the skin is more elastic at a younger age, beginning any surgical intervention is usually suggested earlier on. And so then there's sort of this window of time where parents are deliberating, should we begin this or not? And I think, like you were mentioning, there's a lot of reasons to make different choices, especially, at Nevis Outreach, we really recognize everybody's journey with CMN is so individual and so personal. And so there really is no right or wrong way for anyone, because two people could take exactly the same path and have very different outcomes. And so that's really important for us to recognize and to highlight. And that's why we want to do our best to support everybody in their journey, no matter what it is or where it is, because it can just look like so many different things. So that's just what I wanted to add.
Yeah. And I think too, I would say that there's probably a fair amount. Yes, not to minimize Kelsey's story, like that is her unique journey and where she found herself and that situation. But I would say that there's probably families that, chose a removal journey that might have spanned a similar length of time or something of that nature, who would walk away from that scenario and say, that's the best thing we ever did. I would do it again tomorrow, and not really have that medical trauma story to share. So I want to validate both perspectives. And myself personally, I mean, we have not pursued any removal at this point. I personally think that should be my daughter's decision as she gets older. So she's only 8 right now, but if at some point down the line she wants to pursue it, that's something that I will absolutely support her in. But I just felt like making that decision for her was just not something I was even comfortable as doing as a parent. I feel like that in and of itself is a unique decision.
Yeah. Would you speak a little bit more to that shared decision making, especially as we talk about it as it refers to physicians and clinicians and parents? And because I think that piece is also really important.
Yeah, absolutely. So shared decision making has been something that we've worked on with Dr. Carrie Coughlin she's at the University of, Washington University in St. Louis. I think that's the name of the institution. And so she's actually put together some shared decision making guides and some discussion guides that like you can use with your clinician to kind of say, okay, these are the risks, these are the opportunities, this is the treatment path forward, A, B, and C, and work through with your clinician to make the best decision that you can make for your family. And I think a lot of times we see social detriments of health show up in those decision-making pathways. I know as we think about the medical system, particularly in the U.S., is in no way equitable. I think we could all agree with that. It's going to depend on everything from, are you privately insured, or are you on public system with Medicaid or other 50% of children in this country are insured by Medicaid. So that plays into that. And we will do everything we can if someone is pursuing removal to, appeals. And I mean, I have the template saved on my computer, and it's like something that's very commonly referenced as families need that and want that to even see a specialist, even if it's not necessarily removal related, but see a specialist out of state. Like that's something that we deal with all the time. And then we also, through our conferences that provide support, we also do consultations. So we bring together the specialists and some of the top surgery. There's really one particular surgeon that's done a lot of semen removal surgeries, and he comes to our conference and has for decades to talk with families about those treatment options and, provide his professional expertise for families who are even just weighing their options. I mean, even if it's, we met with him at a conference in 2018 when Maylee was just a baby, to kind of say, if we were to pursue this at some point, what would it look like? And, and took that information, and that did help us make decisions. So I think that we try to facilitate that shared decision making at our conferences as best we can, with experts that really are knowledgeable in their field. So I feel like that's a tremendous asset of coming to the conference and some of the resources that Nevis Outreach can provide for families. But it's also an opportunity. It's also a challenge too, because not even our conference is accessible for everyone. So such is the challenge to like make sure that even families who can't make it to the conference or can't crisscross the country to speak to experts, like feel like they can partner with their local providers. And at the end of the day, a dermatologist is qualified, even a community derm, to monitor the CMN for changes and, be a supportive care partner on your journey. So that's something else that we really want to drive home is, yes, these experts and specialists are nice, but like, your community dermatologist is really okay if that's the best option for you to get regular dermatological care as well.
Yeah, and I love that conversation about shared decision making. And I'm going to find what you're talking about from Washington University, and I will also put that in the show notes, because I think that that's important no matter who you are or what you have going on, is to have some support around shared decision making, right? Because yes, your provider is an expert in the area that they're working in, but you also, it's your body, and to be able to make those choices by being in partnership with a medical provider who's giving you the information and giving you what they know, but to ultimately know that it's your decision is really powerful. So I'm so glad you told me about that. And then the other thing too that I thought about as you were sharing that is within the medical trauma world, one of the layers that a lot of people experience that is really challenging is the piece of getting insurance to pay for something. You talked about having this information that you share with people as they're going and trying to get these visits covered. That's really hard, right? So just acknowledging that piece too, and that we don't all have the same financial resources either. Like there are some people who can't make it to your conference probably because a plane ticket or staying in a hotel is too expensive. It's the same thing with the medical system, right? We are also, I guess, challenged or limited because of that reason sometimes in what we can choose to do. My guess is you have parents who aren't able to necessarily really have the full spectrum of choices because there's a financial component there.
Absolutely.
Yeah, that's a whole other podcast. But I just think it's important to point out because that is really across everything in medicine in our country. Unfortunately, it's not fair. It makes what is already a hard situation even harder.
Yeah.
Right.
Well, especially being a rare condition, we're classified
Right.
as a rare disease. And so it's also oftentimes just getting that initial information, reliable information to be able to make the decisions that you need to make in the first place. And then also, like Lauren was saying, seeking out expert care if you're pursuing any kind of treatment or if you require any kind of special follow-up is in and of itself challenging, right? And then even thinking about it through a lifespan, if you're someone like me who's moved around the world several times, then should I fly back home to try to see the same dermatologist? Do I just stop going to the dermatologist? It's hard to follow through, but that's kind of where that community support comes back in, is when I'm in touch with other families going through similar experiences, then I at least have that social support. Nevis Outreach, I think we really try to make as many resources, free, public that we can, so that at least the educational information is available and it's not hidden or difficult to find, that it's at least like a starting point for families.
Yeah, that's so beautiful. This has been such a great conversation. I really appreciate y'all being here and sharing this. And I'm wondering if there is anything that y'all have coming up or anything that you want to share with listeners.
So I would say September 28th is Global CMN Awareness Day. It's a event that we started last year in collaboration with CMN patient organizations around the world to raise awareness of CMN. So we're really excited about that coming up on the 28th of September. And we're also planning our 2026 Nevis Outreach Conference that will take place in Orlando, Florida in July of 2026. And you can find that on nevisconference.org, all about the conference. And then we're also just online as a resource for CMN families at nevis.org.
So nevis.org. Okay, great. And I will put all of these in the show notes so that people can just click the link and go straight there. And is there anything you want to leave the listeners with that you feel like we weren't able to cover?
I would just encourage that wherever you are obviously probably having some type of medical experience brings you to this podcast. So I would just encourage you to seek community wherever you are. That's so important. And even if it's not semen specific, if it's whatever medical thing you find yourself dealing with, like find yourself a community of your people that understand the road that you're walking. And I want a paper someday. If we want to work together on this, let's go for it. But I want to take paper someday that says families that connect with patient advocacy organizations have better health outcomes. I just truly believe that to be true.
Yes.
When you have a community that understands the nuances of your condition, you just fare better. And so that's a career ambition. Hopefully we'll see realized, I don't know, maybe in the next decade or so, but
we should talk about that. I agree. That's really what I preach. Like, I feel like I preach that every day, and why I created my community, which is called the Befriend Your Body community, because there's a lot of nervous system education within it as well as community, but we all need it. We are human and we need support and we need community, and to be able to be with people who get it, like you said.
Thank you as well, Sarah. It's really lovely to connect with you.
Thank you for having us.
I hope you enjoyed this medical trauma support episode. I wanted to let you know that if you are looking for support as you're healing from medical trauma, you can join our membership community. It is called the Befriend Your Body community, and you can find out more at medicaltraumasupport.com.